had a hard time starting an exercise routine? Or maybe you started exercising, but eventually you stopped again. You're not alone. This is the story with countless women, and there are tips you can follow to help. When women are considering exercise, sometimes they worry that they have never exercised before. The good news is that it's not too late to start, and you don't need prior experience. Ask your exercise team to help you create an exercise routine that is safe and effective for you and works with your lifestyle. One of the first steps to take is to be proud of yourself for moving your body and working toward better health. Self-compassion and positive self-talk will be so important and will actually help you achieve your goals. If you have been exercising, think about the kinds of exercises you've been doing and whether they are working for you. If you tried to get into exercise before, think about the reasons you stopped. Did you choose an activity you didn't like? Did you try doing too much too soon? One way to make it more likely that you will follow your exercise routine is to choose exercise that you enjoy. For some women, that's walking, running, or cycling. For others, it might be Zumba, aerobics classes, aquafit yoga, or Pilates. Ask your exercise team about exercise options in your community. Your exercise team can also help make sure that you have enough moderate to vigorous aerobic activity in your exercise routine. For example, although yoga and Pilates classes have health benefits and may be activities you enjoy, some of these classes won't provide the intensity needed for heart health. It's important to include activity that increases your heart rate for about 150 minutes each week. Now that you have some ideas on what might help you follow your exercise routine, it's a good idea to plan for the many barriers to exercise. A big barrier for women is time. Women often have a lot of roles and responsibilities. If you are short on time to exercise, try exercising at home to save the travel time. You might want to find free exercise videos to follow along with online. You could also try a 10-minute walk around your neighborhood. The next barrier is caregiving. You might be like the thousands of women who provide care for others, often at the expense of their own health. Keep up with prioritizing your exercise, because then you will feel at your best to help. You might want to make brisk housework part of your physical activity, or track the time you spend sitting and try to reduce this by adding more movement in your day. It's true that it's hard to fit everything in, and adding an exercise routine might seem like too much at first. If your heart health is a priority, it's important to use strategies to remove barriers to exercise. Pick one small change or new activity to try for a week so that exercise does not become overwhelming. How you feel during exercise can be the reason you follow your exercise routine or not. If exercise feels tiring, talk to your exercise team. Most often, they can adjust your exercise prescription to make it work for you. You can also talk to your healthcare team about other ways to feel less fatigued. Over time, doing regular exercise will give you more energy. Exercise should not be painful. If you have chronic pain, also called long-term pain, that you take medicine for, ask your healthcare team if your prescription needs to be adjusted. For some people, it may be appropriate to take a pain reliever an hour before exercise, or you might spread your exercise out over the week. For others, a different exercise that is easier on your joints may help. Many women find it hard to follow an exercise routine because of other conditions they have, in addition to their heart condition. Many women have pain in their muscles and joints or arthritis. Ask your exercise team how to manage this pain during exercise. If you have pee or urine that leaks out during exercise, you may have urinary incontinence, a very common condition among women. Talk to your doctor or exercise team about strategies to manage this while you exercise. As women age, it becomes more likely that their bones will become brittle, a condition called osteoporosis. Having this condition often leads to a fear of falling during exercise. The exercise team in a cardiac rehab program are trained to assess your risk for falls and have strategies that will help you avoid falling. The research is clear that it is particularly hard for women to follow their exercise routine long term. Fortunately, there is also research that shares strategies on how to help women be successful. Talk to your healthcare team to learn how they can best support you. Remember, a small change to exercise more is a big step closer to better health.